Hello everyone. Today, let's explore the clavicle, the bone that connects your arm to your torso. Understanding its anatomy is key to knowing how it supports your upper body movement and mobility. Imagine the clavicle as a strong bridge connecting your shoulder to your chest. Just like a bridge supports the flow between two places, the clavicle supports your arm's movement, linking it to the axial skeleton. Moving on to its structure, it has three parts: a lateral end, a medial end, and a shaft. The lateral end is also called the acromial end. It is flattened above downwards and articulates with the acromion process of the scapula. The medial or the sternal end is enlarged, forming a vital connection with the clavicular notch of the manubrium sterni and the first costal cartilage, the sternoclavicular joint. The shaft is the part between the two ends. Now, let's talk about the shaft. It is gently curved, resembling the italic letter F. The medial 2/3 is convex forwards, while the lateral 1/3 is concave forward. The internal architecture of the clavicle is trabecular, with a medullary cavity, but only in the medial 2/3. The cortical bone is thickest at the transition zone between the anticurve and the retrocurve. And did you know that the female clavicle is typically shorter, thinner, less curved, and smoother than the male counterparts? Also, the midshaft circumference is a reliable indicator of the sex. Moving on, the clavicle is subcutaneous throughout its length, making it palpable. The medial end forms a blunt-faced margin of the suprasternal notch. See, this U-shaped depression at the base of neck, located just above the top of the sternum between the two clavicles, is called the suprasternal notch or the jugular notch. So, the medial end of the clavicle forms the lateral margin of the suprasternal notch. The acromial end is often obscured by the deltoid, making it difficult to palpate. Now, let's focus on the lateral 1/3 of the clavicle. It is flattened above downwards, so it has two surfaces. This is the superior surface, and this is the inferior surface. It also has two borders. This is the anterior border, and this is the posterior border. The anterior border and the anterior part of the superior surface gives origin to the anterior fibers of the deltoid muscle. This is the deltoid muscle originating from the clavicle as well as the scapula and inserted onto the deltoid tuberosity of the humerus. The posterior border and the posterior part of the superior surface receives the insertion of the anterior fibers of the trapezius muscle. This is the trapezius muscle extending from the superior nuchal line to the clavicle and the scapula. The inferior surface has a conoid tubercle and a trapezoid ridge. This is where the conoid and trapezoid parts of the Coracoclavicular Ligament are attached. This is the Coracoclavicular Ligament, which plays a crucial role in transmitting the weight of the upper limb from the scapula to the clavicle. Now, let's explore the medial 2/3. It is cylindrical in shape and it has four surfaces without any limiting borders: the anterior surface, superior surface, posterior surface, and the inferior surface. The anterior surface gives origin to the pectoralis major muscle. In the lateral part, it forms the base of the Deltopectoral Triangle. This is the deltoid muscle. This is the pectoralis major muscle. This triangle in between them is called the Deltopectoral Triangle. And the lateral part of the anterior surface forms the base of the Deltopectoral Triangle. The superior surface gives origin to the clavicular head of the Sternocleidomastoid Muscle in the medial part. This is the Sternocleidomastoid Muscle originating from the sternum as well as the clavicle and inserted onto the mastoid process. The superior surface of the clavicle in the lateral part forms the base of the posterior triangle of the neck. This is the posterior triangle of the neck. The posterior surface gives origin to the SternoHyoid muscle medially. See, this is the SternoHyoid muscle, originating from the sternum as well as a part of the clavicle and then inserted onto the hyoid bone. The rest of the posterior surface is smooth. The inferior surface has a rough oval depressed area which gives attachment to the CostoClavicular Ligament. The lateral part of the inferior surface has a subclavian groove which receives the insertion of the Subclavius Muscle. The two lips of the groove gives attachment to the Clavipectoral Fascia. Let me explain. See, this is the clavicle on a sagittal section. This muscle is the pectoralis minor muscle. This strong sheet of fascia between the clavicle and the pectoralis minor is called the Clavipectoral Fascia. This muscle below the clavicle is the Subclavius Muscle. The Clavipectoral Fascia splits to enclose the subclavius and is then attached to the two lips of the subclavian groove of the clavicle. So the two lips of the subclavian groove gives attachment to the Clavipectoral Fascia. And do not forget that the clavicle arches in front of the brachial plexus as well as the third part of the subclavian artery. The shaft of the clavicle is more prone to fractures, often due to violent impact on the side of the shoulder. The lateral fragment can be displaced by the weight of the arm in such cases. If the bone heals in such a position, it can lead to alteration in the retroclavicular space, impacting the brachial plexus and the subclavian vessels. Our exploration of clavicle concludes. Keep in mind that the clavicle's complex structure is crucial for the proper functioning of your shoulder. Now that you've absorbed the contents of the video, let's put your understanding to test with 5 intriguing multiple choice questions. I'll give a link to the quiz in the description. You can also manipulate the model in 3D and VR using Sketchfab. I'll link that also in the description. Until our next adventure, keep that curiosity alive.